Hello, everyone, and welcome to the Nutrition and Aging Resource Center's webinar, Using Data Effectively in Federal Grant Applications. We are excited to welcome Jane Goeken. Jane Nolan Goeken has been a community development specialist with Iowa State University Extension and Outreach for 21 years. She has a bachelor's degree in journalism, mass communications, and a master's degree in public administration, both from Iowa State University. Jane has 35 years of experience writing and reviewing grant applications and working with various federal, state, local, and private foundation grant programs. She developed and presents ISU Extension and Outreach's Grant Writing 101 and Grant Writing 202 workshops. Jane is housed in Spencer, Iowa, which is in our northwest part of the state. Before we get started, I want to mention some housekeeping items. First, we will hold questions until the end of Jane's presentation. Our team will be monitoring the chat and Q&A throughout the session. Please write any questions you may have here. We will start the Q&A session with the chat questions first. You can also raise your hand using the icon and ask your questions orally. At the end of the Q&A session, we encourage everyone to complete the evaluation that is accessible with a QR code or the link that will be placed in the chat. The information you provide will help us during our next webinar. The Nutrition and Aging Resource Center is continuously working to improve the accessibility of events and content. Automated closed captioning will be provided for this webinar. Participants can enable captions by selecting the CC in the toolbar or closed caption in the meeting options. This webinar will also be recorded and made available on YouTube. The video with captions revised for precision will be shared via the Resource Center's newsletter. If you have any questions about captions or additional accommodation requests, please email us at nrcna@iowa.gov. Finally, we did not seek prior approval for this event for CPEU credits for dietitians. You can still receive credit under the CPE activity type 171 teleseminars webinars. Please visit the CDR website for further instruction. Now, without further ado, I will turn this over to Jane. You're on mute, Jane.
Now I think I'm not on mute. Hi, welcome everybody. I'm a little bit different from some of the presenters of the other webinars this summer in that my expertise is not in nutrition and aging. My expertise is in grant writing and using data, actually. I'm a bit of a data geek. As was stated, I've been writing and working with state, federal, local grant programs for 35 years. Yes, I started when I was 12. And I don't want to know how many of you aren't even 35 years old. Over the years, a big part of my job, for a couple decades, was exclusively writing grants for the organization I was with and for other organizations. For the last 22 years, I have taught grant writing workshops to teach Iowans how to write grants. So I'm going to be kind of going at it more from a grant writing perspective than maybe some of the other participants have been. Sorry. First thing I'd like to ask, to get a little bit of information about you. I'm trying to figure out who on here, are you writing your own grant applications internally, or have you been contracting with external organizations to write applications for your organization? Maybe you could put a 1 if you do your own, 2 if you're contracting with somebody. Okay. A little bit of both, but quite a few ones. All right, sounds good. Those of you who are on here, I'm going to ask you another question that's not up here. How much experience do you have writing grants? I'll say 1 if it's none, 2 if it's some, 3 if it's a lot, if you feel like you're fairly experienced. So the small number is you don't have any. 3 is if you have a lot. Good, good. Those of you with, a fair amount of experience, please feel free to jump in as we go along. I'm always happy to learn from those of you, especially that if you have a lot of experience working with aging and nutrition grants. All right. When I was first contacted about this, it was to do a webinar on, data and evaluation. And I kind of pushed back against that a little bit because for me, I want my a little bit more comprehensive use of data with regard to my projects. And it shouldn't even start with when you're writing the application. For me, the most important thing to be thinking of in terms of using data is in the planning part. And that's before a request for proposals comes out, before that grant announcement comes out. It's also during the actual, the narrative section of the application where hopefully you're establishing some benchmarks. You're talking about what the status quo is with your organization, who you're currently serving, how many, those sorts of things. And then hopefully when you get to the evaluation part, you're referencing some of the things that happened previously, some of the data that you gathered during the planning process, and some of the benchmarks you established, while you're creating this project. Every grant application should be written to solve a problem. And I know those of you with a lot of experience are very well aware of this. Every grant application should aim to solve a problem, but your problem can never be that you don't have enough money, because nobody has enough money, right? When you're thinking about identifying your problem, what you want to do is think about the people that your organization serves, not your organization. It shouldn't be that we need new office space, or we're having trouble covering our operating expenses, or the use of our services is declining. The problem should be stated from a standpoint of the people that you serve. What is the problem that you're trying to solve for them? And for that reason, you saying it's a problem is not going to be enough. You're going to have to involve the people whose problem it is into the planning process. As I said, these are things that you should be doing well in advance of when a grant announcement comes out. Hopefully you've identified a grant program that you think might work for you. When I'm doing grant writing training, my first #1 tip is to start early. Start way before that request for proposals comes out, that grant announcement comes out. Typically that comes out a month to 2 months before the deadline for applications, and that's not going to be enough time for you to really do a good planning process. The use of data should start during that planning process. It should be gathered during that planning process, during the identifying the problem part. And in my experience, what's worked best for me, particularly with federal grants, is to use qualitative data to help identify the problem. But that means, quantitative data is numbers-based data, things that are easy to count or measure. It might be how many people you serve, what the cost of your meal cost is, or the meal cost is. Qualitative data, in contrast, is interpretation-based. It's usually language-based. Quantitative data tells you how much or how often. Qualitative data helps us understand why or how or what's causing or what happened with regard to certain behaviors. So before a request for proposals comes out, what I advise you to do is you're working off the previous year's request for proposals and you're starting a planning process. You're gathering data locally to help identify what the problem is that you're trying to solve. Some processes that you can use to gather this qualitative data include needs assessment. It might be a survey, not just the simple survey like, how old are you? How often do you use our services? Surveys that involve some text and, things like, what are some of the challenges that you have been facing as you've grown older and continued to live in your house or your housing unit? A strategic planning process can be used that includes stakeholders, people that you serve, people that don't currently use your services, partners, your council, your board, staff. Other processes might be a focus group. Another one that's been very successful for me is basically helping, as part of this identifying the problem, is to document the formation of a grassroots coalition, a group of organizations or people who've come together because they see an issue in the community. They've called people together that this is something that we need to do something about. That's how we've identified the problem. What's I think is critical for this planning process success is the involvement of lots of different people and organization. The kiss of death for an application is for it to look like you wrote it sitting at your desk shortly before the deadline for the grant program, for grant applications. What's going to be a lot more successful is if you're starting this process well before a request for proposals comes out. You're working off the previous year's request for proposal, because typically they don't change that much from year to year. And what I advise is to pair that with a call or email to the contact person for the grant program so that you can kind of pick up a few brownie points right there. I'm working ahead. We want to make sure, this is a big issue in our community. We've been doing a lot of work with organizations and groups in the planning process. We're working off last year's request for proposals. Do you anticipate a lot of changes? And I'm kind of getting my foot in the door to kind of talk to that contact person a little bit about my community, my region, my project. And I'm checking to make sure that nothing's going to be a lot different in terms of next year's request for proposals. So, as I said, you want to be working ahead. You want to involve as many people and organizations as you can. So I know it's kind of ironic. I'm talking about qualitative data, but part of that qualitative data, I want to use quantitative data as far as how many different partners and individuals were involved in this planning process. For those of you who are doing all the work yourself, you aren't working with an outside contractor, a resource that I think has been really helpful for me or for communities that I've worked with, it's a University of Kansas Community Toolbox. I'm going to go to this. And they've got a lot of resources related to assessing community needs. They have it, and I believe you received links to these. Am I right, Shelley or somebody?
Yes.
Okay. So you have a link to this, but it walks you through, using focus groups, analyzing community problems, collecting information about the problem, so that you're able to say this started, back in September or August of 2023. And maybe you're looking at a grant that's going to be grant announcement's not coming out until 2024 sometime. But you're kind of laying the groundwork. You're collecting this qualitative data so that you can show it's not just me showing this. It's that there's been a lot of people in our community, in our region, that have been involved in identifying this. What especially federal, but state grant makers don't want to have happen is that they fund something and they find out that there's basically one person driving this. They want to make sure that there's a lot of community support, or a lot of community involvement in identifying the problem, and also a community commitment to solving the problem. Another resource is this Administration for Community Living. They do a nice job, or they have been doing, putting some materials from successful applications online that you can look at. one of my 10 tips, that I share with people in our grant writing workshops is get a copy of a successful application. It gives you a good idea of what passes muster, what's worked for other organizations with regard to evaluation, but also their grant application themselves. What sort of data have they used and looked at? Here in these, in this replication grant, they have toolkits that include information about 3 different aging projects. And you can go to the table of contents and go to it and look. It has exactly what they've used in terms of evaluation anyway, and the surveys that they've used and how you use them and when you use them. In addition to that, what I advise you is getting a hold of a successful application for a program that you're interested in. Some people who don't do grant writing as their primary function are not aware that any grant application that goes into state, federal, local government or government funding is public information. Anybody can request and get a copy of it, even if they're not the ones that submitted it. It's not like you can copy somebody's application, but seeing somebody else's application, seeing some of the data that they used, how they set it up is really helpful. You're a different region, you're a different community, your project's different, but it's a really good resource. And it's something that professional grant writers make use of all the time. You need to do it as well. You can go ahead and, somebody that you in your state who got this grant in the past, you can give them a call and ask them. Well, I usually start off by talking a little bit about their project, congratulating them, asking them a little bit about it. And one of the questions I like to ask is, if you're doing this all over again, would you do anything differently? Sometimes they'll say, ooh, we should have included this. We didn't even think about including this in the project. And sometimes they'll say, I wish we'd never seen this grant. I wish we'd never gotten that grant, but that's good information too. So talk to somebody who's gotten the grant, and then usually at the end of that conversation, I'll say, could I get a copy of your application? I've never had anybody be less than nice to me about it. I can't say 100% have given me their application, but I'd say 80% have. The other way you can do it is, as I said, these are public information. You can go and request a copy of the application from the grant program. Some of them might want to slow things down for you or make it a little more difficult. And they might have you do a Freedom of Information Act request. And that's why you want to work ahead. You don't want to be waiting until the request for proposals already come out to be doing that. So I'm going to gather some of that qualitative data during this planning process so that when I'm identifying the problem, it's not just me saying it. I can show that all sorts of people in the community have been involved in identifying this problem. And then I'm going to look for quantitative data to help back that up for use in my grant application. Now, primary data is data that you collect yourself. It might be the number of individuals that you've served. It could be the number of requests that you've received for something that you don't provide, that you'd like to be able to provide in the future, but you haven't been able to. Could be average cost of a meal. It could be the number of partners that are involved in your, in whatever that you're doing currently. Secondary data is data that somebody else has collected. It could be that we're going to the census data and we're looking at poverty rate for residents in our community or our county or our region. It could be that we're looking at USDA food access data. It used to be called food desert. Now it's food access. It could be the county health rankings. It could be a needs assessment that's conducted by another organization. For example, here in Iowa, every county public health agency is required to do a needs assessment on a regular basis. Oftentimes, aging issues are things that they talk about in those. Me being able to cite that in my grant application actually is really helpful because I can show it's not just our organization that's concerned about it, it's other organizations within the community. So if you wouldn't mind in the chat, given us a little idea of what primary data do you currently collect? Some of the data that your organization is currently collecting for the programming that you're doing right now. Age, race, income. Food insecurity, client surveys, meals served, demographic satisfaction survey results. Yeah, there's a lot of data that you're already collecting. Self-reported health outcomes. Okay. Good. Number of people on a waiting list. What data might it be helpful for you to collect in the future? If you're thinking about something that you're, a problem that you're thinking in terms of, I'm sorry, that your community or area has, what data might it be helpful for you to start collecting? Impact data. Resident zip code, I think that might have been for the other one. Want versus need, LGBTQ and demographics, want to avoid finances, concern with storing it. Yeah, you get some privacy issues there. Cost savings, mostly demographics. Okay. Poverty level. Yeah. Okay, good. What secondary data do you currently use? Data that's collected by somebody else. Okay, somebody had said they don't want to do race or sexual orientation, not necessary for food, none. So you're not, in terms of data that somebody else is collecting. Census data, Feeding America, okay. Community health profiles, census. Reports on food insecurity. Okay, USDA food access data, poverty information. Okay, yeah, good. Okay. Is there anything that would be helpful in the future that you think, as far as something that you would like to be able to find out if it's even collected, some sort of secondary data you don't currently use, but you'd like to use in the future, or that you'd like to find out? Need to know some demographic data to ensure we're reaching target populations. Past data to show change over time. Okay. Nutritional data. I got a few secondary data sources here that I think are kind of relevant, possibly, for some of the things that you're doing. The first one is U.S. Census Bureau Quick Facts. Here you can put in one thing that you should be aware when you're talking about census. We don't talk about towns or villages, a place. The city is a place. A town is a place, but you can put in a county. What comes up automatically is the United States, but I'm putting Clay County. I'm in Clay County, Iowa right now. So I can put that there, and it's going to show it as a comparison. So for example, I can go down here and say person 65 years and over percentage. In Clay County, it's 22.7%. Nationally, it's just 17.3%, which helps me make the case that a bigger percentage of our population is older people. They've got a lot of information with regard to housing, computer, internet use. We've got poverty information here too, as far as median household income, per capita income, percentage in poverty. In Clay County, it's 9.4% compared to the state. And you can do a few different things here. I can look at the city as well. This is the city I'm in, sorry. It's supposed to drop down here and I'm not. So now I can compare Spencer to Clay County to the United States, as far as if I'm looking at the percentage of people over or 65 years and over, for example. So this is one that I like to use. This Census Bureau report on exploring age groups. We'll look at this a second, sorry. If we're looking at this, what I want to do is I want to right here say I want to look at counties. I want to look at it as specifically as possible. You know, states. You can go to tracks. I'm going to be in Alabama because otherwise I have to go through this alphabetically and look at it. So Alabama, I can pick out a county in Alabama and get the information for it. I can find out how the state ranks, but I can also find out, I've got aged under 5 years, but I'm going to look at 65 to 84. And I can find out what that is for this particular county. I can find out what the percentage is for 85 to 95. I can compare that to the state and the national figures. Here's the US, the county health rankings and roadmaps. I can put in a zip code or a state or a city. So I'm Clay County in Iowa. And it's going to pull up all sorts of information with regard to health outcomes, health factors, county demographics, county snapshot. One of the ones that I thought was kind of interesting with regard to the populations that you're working with and some of the things that you're talking about in terms of aging populations. Health factors, social and economic factors. And you can hit this in terms of additional social and economic factors. Some of the things that they have here then are things like suicides. You can see what Clay County's is, 27 per 1,000 capita, compared to Iowa's is 16, compared to the United States is 14. If I'm looking at some sort of a problem, and then gives you a little bit more data about, you know, what those numbers mean. But there's a variety of other types of things that you can look at. Another one is, you know, mental health providers. I can compare Clay County, a lot fewer, or what the ratio is compared to Iowa and to the United States. Premature death, adult obesity, quality, you know, in terms of quality of life as far as health. Lots of that information. This is the USDA Food Access Research Atlas. It used to be called, you know, food deserts, but now it's got a different terminology because don't ask me why, but it does. But you can put in your the name of your county, for example. Pick it from the drop down. You can go in here and get a little bit of information. It's talking about availability of grocery stores, but it's also talking about transportation factors and see what parts of your county have issues with regard to food access. This is this elder economic security standard, and you can use that. I think that was talked about in a different webinar. This America's Health Rankings has risk of social isolation over age 25 by county. So you can go in. You need to go by state, and they're by state. But you can, in terms of risk of social isolation, and it talks about specifically, you know, what factors they're talking about: poverty, living alone, divorced, whatever. And it's a comparison basis for your state, but then also nationally. You can, you know, pick out your own county here and look at it. Then I also have some links to background information on collecting and analyzing data for food-related grant projects, and then national best benchmarks for congregate nutrition programs that I thought, in terms of if I'm setting up some benchmarks for myself, it's for our own programs, it's nice to be able to go and look at what the national benchmarks are. Here they have, you know, if you're doing a survey, you can compare. What percentage are 75 age of and older, percentage of participants indicated that one congregate meal provides half or more of their food total for the day. These are the national figures. Eat healthier because of a food program. Are there any other secondary data sources that you have used that you want to cite here now? The ACL data, national data, yep. Okay. National survey done every year. Okay, good. At the ACL website, okay. Yeah, it doesn't capture the 60 to 64. Yeah, that's an issue. And in that case, what I put in the application is, you know, information specific to this population is not available. However, what it is for the whatever, and you can compare it to the national. And I do the same thing if data is only available at the county level, but I'm looking for it for a smaller unit of government, I'll use the county and say I can't find, or it's not available at the city level, but for the county level, which the city is in, this is the data. Some best practices with regard to using data in a grant application or proposal. I want to make sure that I'm citing both qualitative and quantitative data in documenting a problem or a need in an application. As I said, my preference is to use the qualitative data to get people involved in saying what the problem is, what the issue, and then finding quantitative data to help back that up. Now, I'm never going to lie about data. But I'm going to pick and choose the data that helps me make my case. Whenever I'm using data in a grant application, I want to make sure that I am providing a comparison point, the state or national comparison, or the trend over time. You know, 10 years ago, this was the situation. Today, it's this. Otherwise, for the reviewer, they have no idea of how that works out. I want to make it as easy as possible for that reviewer to kind of understand what the problem is, what the issue is. An example I use when I'm doing a grant writing workshop is if I put in a grant application that 30% of students in the school district were eligible for free or reduced price lunch, what does that mean? Do you happen to know what the state or national average is? Unless I'm putting that in, you really have no basis of comparison for that reviewer. And it's right under 40 for Iowa, 40%. The Nutrition and Aging Resource Center data and studies can help document why specific intervention activities were selected to address the identified problem and help establish benchmarks for evaluation. In this, this model study, they had this available 3 times a week. So that's why we're doing that. Or this was what they achieved, so that's what we're going to be shooting for. When we're using data for evaluation, we're writing this into our application, but we're planning for how we're going to evaluate the effectiveness of our project. When we're talking about quantitative data, the numbers-based things, typically it's going to have to be a primary source collected by your organization, that quantitative data, since it's going to take longer for impacts to show up in the secondary data as far as quantitative data. Census reports aren't going to show a difference that quick. The county health rankings aren't going to show a difference in a year or two. Qualitative data, however, can be used more to help identify change a little bit better. Think back to what you used when you were identifying the problem. It could be that you used a survey and focus groups. Or it could be that you're talking about the number of participants or the number of partner organizations that are working with your organization on this new project. You can compare it to before, what the status quo is, and compare that for afterwards as far as some data that you can cite and look at. You can also consider ripple effects mapping or impact mapping as a qualitative data follow-up to a needs assessment. If you're using a needs assessment to help identify a problem or an issue. And both University of Minnesota Extension and Washington State Extension have some information. If you Google them and ripple effects, that you're going to get some information on how to do that as far as help identify impacts. So in evaluation, some of the things that you'd be looking at as far as for use of data, it could be that you used focus groups before. So we're going to say we're going to pull together focus groups afterwards as well. And both in identifying the problem and in the aftermath, when I'm using focus groups, I'm going to have lots of different focus groups. I might have a focus group of people who have been using our services. I might have a focus group of people who don't use our services. I'd probably want to have a focus group of members of minority population group. I might want to have focus groups of different age ranges, for example, and I'm going to do them before and I'm going to do them afterwards. A survey might be another one, or the ripple effects mapping as far as the qualitative. Quantitative, as far as evaluation data, number of individuals served, some sort of a survey as far as number of time that includes number of times that they use your services, some demographic information about the individuals who are using your services. I looked at this before, but there's 3 different examples in these innovation and nutrition programs and services, these replication grants. And it's a really nice place to start to kind of get an idea of what passed muster for evaluations in successful grant applications. There's 3 different examples there. This is the one I looked at where you can go to the table of contents and go straight to those sections of it. This administrative for community living. And as I talked about before, get copies of successful applications, either from somebody who put in an application that was funded or from the funding agency. Now, if you're applying for private foundation grants, what I said about, those being public information obviously doesn't count. It's only grant programs that are funded with state, federal, or local funds, government funds. If it's private foundation, they aren't required to make copies of applications available. And here would be the replication ones that you can go and look at what they had in their grant applications with regard to evaluation. A lot of times, because quantitative data is easy, it's easy to understand. It's clear, it's easy to tabulate. There's an emphasis on using it. And it's important, if we're going to measure change, to know how many do we serve before, how many we served after, what were some of the demographics we were hitting before, what are we hitting now. That said, you want to make sure that you're collecting qualitative data as well. I do the top 10 tips in my Grant Writing 101 workshop. And the 9th one always is, whenever you can put a human face on a problem or an issue, do it. I want to have that quantitative data to back things up. But when you have a grant reviewer who is reading through 10 applications or 20 applications or more, it's the qualitative data that kind of sticks with them. Maybe we had, after such and such a group came together in our community and after the senior center was looked like it was going to close, we had X number of organizations and X number of people come together, and this is what they did to try and keep that from happening. That's what's going to stick out to a reviewer. Or comments like this. It's not just the numbers that are going to make a reviewer kind of sit up and take notice with regard to an application that kind of sets it apart from other applications. I know we've had some chat that I haven't been looking at. The personal impact stories are powerful data when you're talking to funders, in addition to, if you're, applying for applications. Any questions or comments?
Thank you, Jane. If you want to stop sharing your screen, and then they can see you. We do have one question in the Q&A. I encourage all other participants, you can use the chat or you can use the Q&A feature to type in questions, or you can raise your hand and we can unmute you and have you ask it orally. So we have one question, Jane. How do we find state, federal, and local grants that are public question mark.
Publicly funded, right?
Yeah.
Talking Dinah.
Yeah, do we contact the grantor? That's the question.
You can contact the grantor, and if you feel weird about it, you say, attended this webinar and this extension person was really nagging us about getting copies of applications. She pressed the point that these are public information. I would like to get a copy of such and such application. If you know that there's an application that was funded last year, if they have the list of what they funded, that's kind of similar to something that you're looking at doing, you can cite that particular one. They used to be able to say, well, it's going to cost you 50 cents a sheet and we're going to charge you for whoever's making copies. Most of them are going on in line, so they can't do that anymore. But they might have you put in a formal freedom of information request for that. And if so, do that. But it might slow things down. That's why you do not want to wait till the request for proposals comes out to start that process. The other alternative you have is when they do a list of who they funded last year, contact one of those grantees, make a call, say, hey, I saw you got funded for $400,000 for such and such project. Congratulations, what a coup. Can I talk to you a little bit about your project? And, ask them some questions about it. And then towards the end of the conversation, like, could I get a copy of your application? Now, most organizations, they're hoping that somebody's going to help them out down the road when they're applying for a different program. Most organizations have been more than happy to help to say, yeah, sure, I'll give you a copy of it. They've already gotten their money from the program. Even as I said before, I can't say 100% of them will say, sure, we'll send you a copy of our application. But most of the ones that I have dealt with in the past, I haven't had a problem getting a copy of applications from them.
We have another question in the chat. We have a couple in the chat. Let me see. The hardest part of any grant I've written is the part where we must describe how the activity will be funded after the grant ends. What are your best practices?
And that is a big deal. And it's the sustainability issue. Nobody wants to fund something that, yeah, we'll keep it running for a year. What I want to do is I want to have things in place that are going to, like a commitment from the county that they, once we get this up and running, they will be willing to put in X number of dollars a year. After if the grant funds you for 3 years, they'll be willing to. A letter of commitment from them. It might be that once we've paid for some of these initial costs that include equipment and training and that sort of thing, we're going to be able to charge a fee or have a sliding fee schedule. And we'll be bringing in some revenue based on that. But one of the big ones is partner organizations, the county public health office, or maybe you can get a corporate sponsor who'll say that they'll step in at year whatever and be willing to pick up some of these costs.
Jane, another question that's in the chat, and I'm not sure if this was just stated or if they want an answer, so I'm going to ask it anyway. So it's in relation to this personal impact stories. And how can we collect information without being extractive of participants and maintaining their dignity?
Well, one of the things that you can do is if you're doing focus groups, you can do transcripts from them. You can record them and you can ask. Typically, you can ask them to sign something that says that what they've said can be used. But I'd probably go back to that individual again. Like the Ken one. The picture of Ken wasn't Ken. That was somebody else's picture. I'm only using the quote. They're only using that person's first name, in terms of the qualitative data that they published or used. So that might be a possibility.
We still have time for more questions, so you can ask them in the chat, in the Q&A, or I believe you can raise your hand and unmute and ask it orally.
Jean Lloyd cited some really good national data sources in terms of at the ACL national data site that is in the chat box there. Anybody want to share anything that's worked for them in the past with regard to, collecting data? Excuse me. I am a big advocate, as I said earlier, of I'm working ahead. I'm using last year's request for proposals, and I'm using that as kind of a foot in the door to contact the contact person for that grant program. Once that request for proposals goes out, particularly with federal grant programs, there only certain, there's only certain information that they're going to share, kind of just the facts, ma'am. Once that request for proposals goes out or the grant announcement, that 1 to 2 month period between when the announcement comes out and applications are due, the contact person for the grant program is not providing a lot of additional information. They're trying to make it a level playing field for everybody. But if you're talking to them 6 months before the grant announcement comes out, there's a lot more things that they can talk to you about or make suggestions. You can say, this is what we're looking at doing. Do you have any suggestions, or anybody that's done something similar in the past 3 years that that really turned out well? Could I get a copy of that application? If you're waiting until the request for proposals comes out to do this, you're shooting yourself in the foot. You're not going to get that information. But if I'm talking to them well in advance of when that request for proposals comes out, there's all sorts of things that they can tell you. That person's job is to make sure that they get good applications, that they have good projects to fund. That's what I'm doing too, right? I'm trying to make sure they have good projects to fund as well.
Jane, we had a question in the Q&A.
Sure.
Do you find federal grants different for evaluation and data from other types of grants?
Yes, I think most of the time there's going to be a much more rigorous evaluation component. There's some federal grants that grant programs that expect 10% of your budget to be spent on evaluation activities. And for some education grants, there's even bigger than that. So yeah, generally there's going to be more rigorous evaluation protocols expected.
We have a request for your workshop, so I will be sure to send out that information for the Grant Writing 101 and 201 workshops that Jane facilitates.
We do have one coming up we do them face-to-face, and we do Grant Writing 101 face-to-face, but we do it online periodically. And we have one coming up, I believe, on the 30th of August from 9 to noon, and it's $25. I'll get that information to them to send out to you if you're interested in participating.
We have another question in the Q&A. If
Sure.
we don't have the expertise to complete evaluation, who are partners we could work with?
Say that again, I'm sorry.
If we don't have the expertise to complete evaluation, who are partners we could work with?
You know, you might want to check with your state or county extension office. You might want to check with a regional council of government. They do a lot of grant writing and strategic planning, in addition to, it depends on what state you're in with regard to what sort of resources extension can offer. But those are some possibilities. There's also private consultants. You can talk to, if you're looking at the list of who was funded last year for this grant program you're interested in, you're talking to a couple people who got grants last year, getting some information from them, you can ask who they used.
All right. So I'm looking at the time. We have time for one more question before we give you some follow-up information regarding the Resource Center.
Sarah, did you see there was a question in the chat?
No, I did not.
So I'll read it. I am in this only 6 months. When you say using last year's request for proposals, are these grants you applied for last year and you kept track of it for this year?
All federal grants, grants.gov is going to have a listing of all the federal grants that are offered. You can, if there's a place up at the top when you go to that, it says current opportunities or current ones. That means that the request for proposals has currently come out. Generally, there's a month to 2 months between when a grant announcement comes out and the applications are due. But if you don't say you want just current ones, you can look at ones that came out in the past and pull up the old grant announcement. The one that I shared with you for the ACL ones that had the examples in them, for example, that's from last year's. They haven't put out their new one for the upcoming year. I think it comes out maybe in November, and applications maybe are due in January. I'm not 100% sure on that. But so I'm looking at last year's, because typically those grant announcements do not change that much from year to year. So I can kind of start a planning process based on last year's, and then I pair that with a call to the contact person for that grant program. For any of those federal grant programs or state ones, when you pull up the last grant announcement, it's going to have the name and the email address and the phone number for someone who is the contact person for that grant program.
Thank you so much, Jane. I know that Savannah placed this in the chat, but
the link for the grant writing workshop, this is just kind of a generic one. I'll get a copy of it to Savannah or Shelley as far as the link to register. You register online for a Grant Writing 101 workshop.
thank you, Jane.
Okay.
So we do, this whole webinar has been on evaluation, the importance of it. And so we too are taking evaluations from you to learn how we can continue to improve the Nutrition and Aging Resource Center webinar series that we do. If you'll scan this QR code or go to the link that Savannah placed in the chat, we would appreciate it. And I just want to say thank you so much for joining us today. Jane, the responses in the chat show how valuable your presentation was today. And I think that a lot of people are walking away with new information and new action steps that they can take to improve their funding potential with grants. The webinar has been recorded and it will be posted at a later date on the Nutrition Aging Resource Center's YouTube page. And this information will be shared when it is available via our e-newsletter. Again, I want to thank Jane and all of our participants for taking time today to learn more about evaluation. Thank you.